see your hair falling out in clumps, particularly when you've got a new baby to attend to or you've been unwell. It is a really scary thing that can happen.
And we're seeing a lot of hair loss with people taking the new injectable medications. How much hair loss is normal and what's abnormal? A lot of people don't necessarily know what it is and don't know what to do about it. It can be really distressing when your body's under stress.
That can then cause the hair to go, what is going on? So great to see you around today. We are going to do our first mini episode on all things hair. We're going to deep dive a little bit on a particular type of hair loss called Telogen Effluvium, or TE.
TE is really common and a lot of people don't necessarily know what it is and don't know what to do about it. It can be really distressing.
Really anxiety provoking, isn't it?
Absolutely.
Yeah.
So what do you tell your patients about what TE, what does that even stand for?
TE, or Telogen Effluvium, refers to a specific type of the hair cycle. So our hair is constantly cycling. It grows, it's in a resting phase, it sheds. And that's perfectly normal. That's not an abnormal state. In some cases, when our body gets extra stress, so whether that be with illness or pregnancy or even postpartum after you've had a baby, the physiological changes that our bodies are going through means that parts of the cycle become a bit more accentuated than they would ordinarily. And one of these parts is the telogen phase. So instead of holding or growing in a growth phase, the hair is shed a little bit excessively. Can cause a lot of stress and a lot of anxiety, as you can imagine, to see your hair falling out in clumps, particularly when you've got a new baby to attend to or you've been unwell. So it is a really scary thing that can happen.
Totally. I really explain it to patients by saying when your body's under stress, it focuses on the more important things like keeping our brains going, keeping our heart, our liver, and our kidneys alive. And so our hair sort of is the innocent bystander.
Bit cosmetic.
That's it. So guys, I'm not going to grow you. You guys can go rest for a while while I focus on, keeping the body alive.
Yeah, so it's a way to re-establish what's important while the body normalizes or gets healthy again.
That's right. And the common things, exactly like you mentioned, was pregnancy or when you're really unwell. The two things I think we've seen more commonly are things like COVID.
Yes, that's another cause, really common.
And we're seeing a lot of hair loss with people taking the new injectable medications for diabetes or weight loss.
Exactly.
Such as Ozempic and Wegovy and Mounjaro.
Because again, these are pushing the body into states it's not ordinarily used to being in, and that can then cause the hair to go, what is going on? Let's just pause while we get better.
That's right. Yeah. So what do you tell patients about when to expect TE? When does it commonly happen?
I think it's better for patients to be pre-warned. So if they're starting any of these new medications, if they're pregnant, and particularly if they've had a hair issue before, it's really good to know what's coming. So I think warning patients that any state that the body's going to go into that's not particularly normal for them can induce this hair loss. Also, when patients are really unwell, so ICU stays, but also just unwell with bad flu virus, COVID, as you mentioned, that can really stress out the body and cause this thing. They often first come to me saying that the hair's coming out when they wash it more often. They're seeing big clumps in the sink, or even when they wake up on the pillow. And that can be a normal phase, but it's really just trying to get an idea from their own history, but also from examining the patient, how much hair they're losing.
That's a really good point. So often patients say to me, well, how much hair loss is normal and what's abnormal? How do you respond to that?
Yeah, exactly, because it is normal to lose hair, and we actually lose a lot more hair day to day than we think and then we realize. When you come to see a GP or a dermatologist about this problem, often they'll do what's called a hair pull test, and that can just be to quantify how much hair is coming out or if the hair is easily detached from the scalp.
That's right. So I often say to patients, it's normal to lose between 100 to 150 hairs a day.
It's quite a lot, isn't it?
It is quite a lot. Yeah. And the truth is, you're not literally seeing them all the time. Sometimes they'll literally blow away in the wind. Sometimes they'll come out with your brush. You don't necessarily look at it, go down the drain in your shower or your bathtub. Yeah. Or sometimes they just sit in the scalp, haven't fully detached or fully left the scalp, and then they'll all come out when you're washing.
Yeah, exactly.
So it is important to know that hair loss on a day-to-day basis is normal. But telogen effluvium is an excessive or accentuated form of hair loss where you get that very positive hair pull test.
Yeah, and that can be quite an alarming state to be in. So often the next step, once you have that definite history of excess hair fall, then it's about looking around for signs. So is there any inflammation of the scalp that could be triggering this? Are there any other signs of any other hair disorders going on? Because these conditions do tend to coexist. Then going back through the history and trying to pinpoint when the illness happened or when the patient was unwell, and sometimes doing some extra blood tests to check that there's no underlying cause.
That's right. And sometimes I'll ask patients, did you have a fever or some sort of infection, a cough, cold? And they'll say no. You do a little bit more digging and they say, but there was a lot of stress recently. Maybe there was a death of a loved one. They might have had big surgery or a car accident even, some sort of shock to the system that's triggered the TE.
And often I find that sort of predates the onset by 3 months or so. So it is interesting to see that correlation.
You really have to go through the recent months, and it can be quite hard to remember sometimes what was the trigger.
Yeah.
Let's say you've established that diagnosis. You think this patient has an acute, that means a sudden onset TE. What do you tell them?
I reassure them first and foremost, this is a temporary thing. There's no evidence of scarring, which can be a hair disorder that is difficult to treat, difficult to reverse, but this will most commonly completely reverse and be curable. So then identifying and trying to rectify, if we can, that source of the problem. Often if there's a stress incident, looking into that a bit further. But if there's no obvious cause, then some blood work is sometimes needed to look at iron status, nutritional status, and if there's any signs of chronic inflammatory disease states going on in the body.
I'm so glad you brought up iron status, because I don't know about UK, but one of the most common things I see, particularly in my female population and young females especially, is iron deficiency.
Isn't it so common?
So common.
It's uncommon to see a female come back with normal iron results. And I think that's because obviously periods, and that's an onset that's earlier and earlier now in our generations. And I think the toll of that can be chronic iron deficiency anemia.
That's right. So the blood tests are a really important part of making this diagnosis. So let's say we've reversed their iron studies, we've got them nice and high, either they've taken oral supplements or maybe had an iron infusion.
Yeah.
What's the next step? Are there pills that you recommend?
There are. Then I like to look at if we can topically reinforce that hair unit to give it every chance we can to restart the growth phase of the hair cycle and stop falling out. So I like topical products which are over the counter, like Minoxidil. They work really well to push those hair follicles back into the growth phase. It does come with a bit of a warning. That first 6 weeks can trigger a bit more shedding. So the patients do need to push through that. But if you can and get through that initial phase, it can work really well long term.
I totally agree. I think that topical minoxidil, usually at 5%, can work really well. You don't need a prescription for it. And just like you mentioned, I explained to the patients, like, we're pushing a new hair follicle, a new hair shaft, out of that hair follicle, and it actually helps just release the old one. So don't be afraid.
Yeah.
You might get that initial shed, but that's a sign that the medication's working.
Yeah.
Have you ever used oral minoxidil for TE?
I do use it quite commonly, in combination with topical even sometimes.
Right.
I find I start at a low dose, just double check there's no side effects, although generally this is a really well-tolerated medication. And again, it can take a little while to have the benefits, but if that's something that's enduring, you can see a really great result.
I totally agree. And I think the one thing to tell patients is that usually the telogen effluvium is self-limiting, which means that it will end by itself after a period of 3 or 6 months. But they may not necessarily regrow all the hair if they've got the genetics for what we call patterned hair loss, so male or female patterned hair loss. Do you agree?
Absolutely. Often there is another problem unmasked with these sort of conditions. And that's why oral and topical minoxidil both do a good job of just supporting that growth phase so that hopefully that side of the issue is minimised.
I couldn't agree more. And I think that's the perfect introduction for our next topic, which will be all about androgenetic alopecia.
Can't wait for that one. Fact or fad, hair loss. Washing your hair every single day causes it to thin and fall out faster.
Fad.
Applying pure rosemary oil directly to the scalp works just as well as medical grade minoxidil.
Fad.
Consistently wearing tight ponytails or slick-backed buns can cause permanent bald spots.
This is true. So it's definitely a fact.
Definitely.
It can definitely put too much tension on the hair follicles and destabilize them.
Taking high-dose biotin gummies will effectively stop hormonal hair thinning.
Fad.
A major stressful event can cause your hair to fall out in clumps 3 or 4 months after it happens.
Fact.
And finally, that relying heavily on dry shampoo without doing clarifying washes can clog the follicles and lead to hair loss.
I have no idea. What? What?
I think that's a fad.
Fad?
That
Okay.
relying on dry shampoo without washing can clog follicles to lead to hair loss.
Fad.
If you found our hair loss episode helpful, then please subscribe.